I had problems with my knee when I was 13. I ended up with several surgeries, and I was out for 2 seasons of football myself, so it made me think about orthopedics in general, and then even more sports medicine. And then when I started actually doing sports medicine during residency, I fell in love with it. First thing is we take a look at the knee, see if we see what's going on. We'll get x-rays, make sure we don't see any fractures, and then depending on what we find, we go to our next step. Sometimes this is therapy, sometimes we need to go to MRI. If it's something easy, just we need physical therapy and it doesn't involve surgery or a fracture or anything like that. It's pretty simple. We got to get them where their pain's down, where they can walk without a limping, and then be able to run, and then eventually do their activities that they need to in a game before they can go back. If they can't do it with me, they're not going to be able to do it during a game. A lot of times shoulder injuries are based kind of on age. Usually younger people or young athletes will have more problems with instability, so their shoulder wants to slip out of place. We always start with therapy, try to get their muscles strong to hold it in place. If this doesn't work, then we talk about doing arthroscopic surgery and repairing some of the ligaments and the bumper in the shoulder to help hold it in place. Some of our older athletes, they tend to get more rotator cuff problems. Sometimes this is a tear, sometimes it's just irritation. We start with, again, therapy. If we can let them compensate, do what they want to do without a surgery, then that's what we do. Sometimes we have to go in and clean up the shoulder and maybe even repair the rotator cuff. Most people we can get back. I would say maybe 20% of the people I actually see end up going to the surgery. Usually we can get them back to their activities with the right type of care, right type of physical therapy.